Dr. Goldsmith, a very common problem amongst children is they wake up in the night and they have ear pain. What's that all about?
Well, it could be just a child with some poor sleep patterns. It could be an ear infection. It could be teething. It would be hard to tell just if they're waking up without actually having them examined. But those would probably be the most likely things, some type of dreaming or teething, or obviously an ear infection, which is very painful.
If a child goes to a pediatrician, is obviously under the age of 3, and he starts to see a red bulging eardrum with a lot of pain, he will probably treat the kid with antibiotics. Is that correct?
Most ear infections are treated with antibiotics, correct.
Okay, we're talking under 3 now.
Right.
Okay. What would be your consideration, the drug of choice that we usually use as the first-time ear infection?
We always want to try to start with the weakest antibiotic that will work, because this way we don't allow the bacteria to get too smart, and we also make the child better. So the amoxicillin, which is an oldie but a goodie, is usually the way to start. If the child's allergic, we would try something else. But again, you want to try as you don't want to be using very, very strong antibiotics when not needed, because then you won't have them when you need them.
A lot of times people get calls from pharmacies, they see these doses that are very high. Why is that?
Well, we're now recommending that actually amoxicillin is used at a higher dose, because it allows the amoxicillin to cover more of the difficult bacteria. But again, we're still using the nice, safe drug that we've been using for a very long time.
So a 20-pound 1-year-old would probably get how much amoxicillin?
20 pounds is 10 kilograms, 10 times 90 is 900, so it would be about 450 milligrams twice a day, which is a hefty dose.
So
That's the correct dose.
a lot of farmers get nervous to see those figures, but that is the
Great
new,
drug, it's safe, and that's the way to do it.
That's the new recommended dose.
That's
is that
it.
correct? There's also a concept, wait and see, with some of the older kids.
Right.
What's that all about?
Well, in Europe, for many, many years, the attitude towards ear infections has been that the body's immune system is able to take care of that without any antibiotics. And indeed, that's the way they've been doing it for Europe for many years, and a lot of studies have shown that's a very effective way. We've been a little late here in America in starting that up, but now the new recommendations from the Pediatric Academy, and these are correct recommendations, is to, in older kids who are not that sick, we would try a wait-and-see approach with an ear infection, which means that we would examine the child, confirm there's an ear infection, and then tell the parents that we're going to see what happens over the next 48 to 72 hours. If the child is able to get better on their own, that's a better way of fighting the infection, and we avoid antibiotics. If the child gets worse despite that wait-and-see, then we just give them the antibiotic and they get better.
So if the kid is not in too much discomfort, yet we do see the classical signs of an ear infection, it's reasonable in an older child to wait and see.
Yes.
Less likely in a younger child.
Right. Younger kids, we don't like to take chances because of the complications of ear infections.
But it seems kids sometimes very young get a lot of ear infections. Is that something I'm doing wrong?
You as a parent or you as a pediatrician?
It's a parent.
No, you're doing nothing wrong. Ear infections are the most common medical problem in kids after upper respiratory infections, and the most common reason they get antibiotics, and the most common reason they get surgery. So a lot of kids get ear infections. They're most common from age about 6 months to 18 to 24 months. And as long as it's not happening that frequently and the child's quality of life is good, we don't get too nervous.
If a child keeps getting ear infections but seems to have a lot of fluid persisting, some kids get tubes.
Right.
Why?
Well, the problem with fluid, as you would imagine, is that if there's fluid in the ear, then the hearing is temporarily blocked. And if the hearing is blocked for a long time during critical times of the child's development, then that could theoretically affect their speech, language, learning, school performance. So if their child has chronic fluid, meaning that's lasting for a certain amount of time and it's affecting the hearing, at some point we would recommend that we drain the fluid with the tubes. Not right away, but at some point.
How long would a kid have to have this fluid before you, as a ENT guy, would consider putting tubes in?
There's no official number. I mean, there are recommendations, but in general, 4 to 6 months of fluid that's not going away, affecting the hearing, affecting maybe articulation, speech, language, or learning, we would recommend tubes.
If you put tubes in, there's some things parents have to be aware of because it works in 2 directions. Is that true?
The initial thinking used to be that, and this is up until recently, that if a child has tubes, they can't get their ears wet. And you see kids looking around the pool with earplugs and headbands. The data recently suggested that may not be needed, that kids that have ear tubes can get their ears wet, and most kids will be fine. If we try that, but they're getting episodes of drainage more frequently than we're happy with, then we would make them use earplugs. So in general, the best thing with tubes is to leave them child alone, let them forget they have tubes, and see what happens.
So if a doctor saw the kid 10 days after proper treatment, saw some fluid, that doesn't mean you need more antibiotics, does it?
That's perfectly normal. You'll have fluid up to 6 to 8 weeks after an ear infection. Less and less fluid as the weeks go by, but fluid is normal after every ear infection. If I get an ear infection today, and you looked at my ears in a week or two, I would still have fluid.
So in other words, the tubes don't cure the problem, but they help the kid hear better?
They temporarily make the problem better, and hopefully the child outgrows it. And when the tubes come out, hopefully end of problem.
Thank you.